This meeting is being recorded.
Hello, everyone. We want to thank you so much for joining us today for our live chat. We're going to be getting started here in just a few moments. But before we do, I wanted to introduce myself. My name is Lakelyn Hogan. I'm gerontologist and caregiver advocate at Home Instead Senior Care. And again, thank you for joining us today on the live chat. Our topic is brain health for women caregivers. These live chats are brought to you by Home Instead Senior Care, a network of locally owned franchise offices. The Home Instead Senior Care Network offers in-home care with an individualized approach to help keep your older adult loved ones safe and independent at home. And to learn more, you can visit homeinstead.com. And before we kick off today's chat, I did want to go over just a few housekeeping items. We are using a new system for our live chats. If you're a follower of these chats, you might notice that your screen looks a little bit different, but we still did mute everyone's lines so that you can go about your daily activities as you listen to us. So we can't hear the doorbell or the ring or the dog bark. If you need to do dishes, don't worry, we can't hear you on our end of things. And we do still have the question box, but it's in a different location. It's at the bottom of your screen. So you can see the box that says Q&A. You can open up that box and type in a question at any time. We do have on this platform the ability for everyone to see your questions, but if you do want to keep your question anonymous, you can submit it anonymously. So when you go to send the question, you can click send anonymously and it will not show your name. So I did want to let you know that that is a little bit of a different function on this version of our live chat. So again, type in your question at any time. There's no such thing as a silly question, and your questions always help others learn as well. So please, no matter if it's now or throughout the hour, type in your questions there. And then we are recording today's live chat. You don't need to worry about taking any notes. We will send the link to the recording out to you via email, the same one you used to register for today's event. So if you want to listen to it again, or if you want to send it on to a family member or friend, someone in your community who you think would benefit, please feel free to do so. And we'll also post it back on our website, helpforalzheimersfamilies.com, and we'll share that site at the end of the chat on our resource slide. All right, so I think that takes care of our housekeeping items for today. So let's move into our live chat topic. Some of you may or may not know that this month, the month of September, is World Alzheimer's Month, and tomorrow is actually World Alzheimer's Day. So this whole month and then all day tomorrow is dedicated to bringing awareness to Alzheimer's disease and really a call to action for more care and support and research all over the world. So it's very timely that we're talking about a very hot topic in the Alzheimer's and dementia space, and that is women and caregiving and Alzheimer's disease. So we know that women are disproportionately impacted by dementia and Alzheimer's, both in the care they're providing. So there are more female caregivers than male caregivers. And we know that more women are developing the disease than men. So today we're going to be touching on a variety of topics that all focus on women and caregiving, Alzheimer's and dementia. We're going to talk about factors that impact women's brain health. We're going to talk about identifying some warning signs of an unhealthy brain, and then offer some practical tips to prevent your own cognitive decline as you age. And we'll talk about how it's really you're never too young to start thinking about your brain health. And we're really fortunate to have an expert on this subject with us, Lynn Posluns from Women's Brain Health Initiative. Lynn is founder, president, and board chair of the Women's Brain Health Initiative, which is a global foundation raising money for research and education to combat women's aging brain disorders. While serving as founder and chairwoman of Baycrest, Lynn recognized the need to raise awareness and funds beyond Toronto to help women stay brain healthy longer. Lynn's passion and commitment for the cause now continues on a worldwide basis, supporting worthy institutions that want to combat combat this impending crisis. Since graduating from the University of Toronto with an undergraduate degree in commerce and finance and a master's degree in business administration, Lynn has held a number of positions within the retail and fashion industries, including president of Fairweather, and managing partner of Canadian clothing designer Gopher Kayak. And Lynn is currently managing director of Cedar Point Investments, Inc., a private equity and alternative investment firm based in Toronto. Lynn is heavily involved in the community and has received many awards, including the Queen Elizabeth II Diamond Jubilee Medal for outstanding leadership at Baycrest and her vision for launching Women's Brain Health Initiative. So, Lynn, thank you so much for joining us today. We are so honored to have you. Welcome.
Thank you so much, Lakelyn. Happy to be here.
Well, we're so happy to have you. And Home Instead is a proud member of Women's Brain Health Initiative. I've been to your events and been involved in learning about Women's Brain Health Initiative and all that you do across Canada and the U.S. and the globe. So would you mind by just starting off and giving us an overview of Women's Brain Health Initiative and your mission and some of the things you're working on right now? That would be really helpful.
Sure. Women's Brain Health Initiative is a charitable nonprofit organization that I started in 2012, both Canada and the United States. And it is the only charitable organization that's solely dedicated to protecting the brain health of women. And I started this because I discovered that almost 70% of Alzheimer's sufferers are women, that women suffer from anxiety, depression, even stroke as we age, twice as much as men, but research today still focuses primarily on men. And as a woman with 3 boys, that didn't sit well with me, knowing that the research was focused on men if women were more susceptible. And the susceptibility comes from more than just the fact that we live longer than men. But the scientists didn't understand why, if you have the genetic risk factor for Alzheimer's disease, you're 50% more likely to succumb to the disease than a man with that same gene sitting right next to you. So the fact that more women suffer from these ailments than men, without a good understanding of why, we initiated the charity in order to level that research playing field. So at the grassroots level of research, where they're studying lab rat behavior, it's actually the male rat that's studied because the hormones in the female rat make us too complex. And again, complexity shouldn't discount the fact that the scientists aren't looking at why women, again, are more susceptible. So even in clinical studies, again, women participate way less than men do. So at any level of study, the focus has been on males. So we wanted to fund the female rat studies and make sure that women did go into these clinical trials and that they were looked at by the scientists in their various studies. So part of our mission was to focus on the female side of the story. And the second part is to educate people, particularly women and young women, about what they can do to protect their cognitive vitality as they age. And the reason that this is important is really because of 2 reasons. The first is we now know that when symptoms of diseases like Alzheimer's, which is the most common cause of dementia, when symptoms first surface, it's likely that the damage has happened 20 to 25 years prior. So what that means is that diseases like Alzheimer's are really midlife diseases whose symptoms show up in old age. So the earlier you start thinking about what you can do to protect your cognitive health, the stronger the protective effect will be. So that's why when you said, it's never too early to start, we really believe that. But again, when you're in your late 20s and 30s, probably the last thing you want to think about is, your brain health. You're building your career, you're trying to get enough money to, buy your first home, you're starting your family. The last thing you want to think about is your brain health, but it's really important to start young and as early in your youth as possible, so that when you're in your 70s and 80s, you've got your cognitive abilities intact. So the education is as important as the research. So 2 parts of our mission.
Thank you so much for that, Lynn. I think your mission is so important, and as a younger, adult female, you're right. I have all these things going on, and I don't take time to stop and think about my brain health and how what I do now can affect me years down the road. But my awareness is becoming more heightened, and it's probably because I work in this field, but I also, I think that you guys have done, at Women's Brain Health Initiative, have done such a great job of reaching women where they are. Would you mind just kind of telling us a little bit about your outreach programs at Women's Brain Health Initiative and ways that you're able to get the information out that's easy to understand? Because I think for some people, we're intimidated by the science side of it, but we want to understand it. So if you could talk about ways you guys have found to be most effective in communicating it, I think we could all learn from that.
Okay, so just to back up 1 second, this also touches on your point. So one of the reasons I said the education is important is because we now know that symptoms occur years past when the damage starts. But also the other point is that a third of all cases of dementia are avoided through lifestyle choices. So now coming back to your point about the type of outreach that we do, it's really important to take the science, which can be complicated, and put it into lay terms so that the general public can understand. So one of the effective ways that we do that is through a periodical that we call Mind Over Matter. And it's a series of articles all about what's happening in the scientific community, particularly for women, in terms of what people can do to protect their cognitive health, or what's happening on the research side currently, even if they don't have all the answers. What is some of the current thinking? For instance, I'll give you some examples. Some early detection methods are being developed now, because again, the earlier you find out that you have a problem, the greater the chance of you doing something about it. So some of those new detection methods are, for instance, an eye exam. The back of the retina can show some types of deterioration that could be indicative of dementia happening in your brain. So that type of information we like to share in this magazine called Mind Over Matter. It is available online, but it is easier to read in hard copy. And the demand for this material, this information, was so great that we introduced something called a book or social club program. And what that allows somebody to do is go onto our website, download a form, let us know how many people are in your book club or social group, and we are able to send you copies of the magazines free of charge, at the moment free of charge. And that's because currently the magazines have been co-funded by Brain Canada, which is a part of Health Canada, and they've allowed us to print more copies so that we can get more people this information. So that's one method that we use to communicate the science in lay terms. We also hold events both in Canada as well as the United States, which again provides some learning opportunity around what people can do to protect their cognitive health as they age. So those are two important ways. And then, of course, having this opportunity to chat with Home Instead, Lakelyn and Home Instead, is also a great way to get the information into the hands of the public.
Well, yeah, most certainly. I think all those avenues are so unique, and I've had the opportunity to read that Mind Over Matter magazine and look forward to it coming out, each new edition. The way that you lay out the magazine is so beautiful, and it's just easy to digest the information, and you really cover, a wide variety of topics, which I think is so great. I think this last edition, if I remember correctly, was focused on caregiving, or there was many articles around caregiving, which
yes.
Wasn't that the case?
Yes, and we try and get different perspectives. On the one that we have coming up, which will be out beginning of November, was an article that's titled "The First Time I Knew," sort of when the penny dropped. A lot of people sort of have a point in their mind or a particular situation where they recognize that their loved one was in difficulty, cognitive difficulty. And we wanted to share those little tidbits of information, just again to give people a better understanding of what others may have experienced in this journey.
I really look forward to reading that, because I think as I talk to caregivers, you know, hindsight's always 20/20, and they look back and they say, you know, if I really think back over the last couple of years, there are some definite moments when I should have maybe encouraged a doctor's visit sooner, or approached my loved one about whether or not they're noticing cognitive changes. So that is some great information. And actually, Wendy just wrote in and she asked, how do you get copies of this periodical? So would you mind repeating again, Lynn, how people can get connected? I know we're going to share your website at the end of the webinar. So we do have that resource coming up on a slide.
Yeah, so the website is womensbrainhealth.org, and there's a tab that says Get Involved, and if you go there, one of the ways to get involved is through the book club, and that will lead you to a form that you can let us know how many people are in your social group or book club, where we can send these magazines, and we're happy to do so, both right now across Canada and the United States.
Great. And then I know that the past editions of each of the magazine are online, so people can find those on your website as well. Is that correct?
Yes, and again, we're happy to send copies. What happened is we thought about doing the book club because a few women had taken a copy that they received through our national newspaper. That was the way that we distributed it here in Canada. They took the copy to their book club, and there was so much interest in these articles that they asked if they could start up a book club program with us so that they could make the articles the following month's mandatory reading. And so we started this, and it's been overwhelming, the response that we've had to this. And I think it's because today, Alzheimer's has now moved ahead of cancer as the most feared disease. You know, your bodies are lasting longer thanks to modern medicine, but, you know, what's the point of having your body survive if your brain isn't sort of intact as you get older? So this type of information is important for caregivers and just for women in general. Well, really everybody, but it is geared specifically to women. And we have articles that are beyond just you know, Alzheimer's and dementia. One of the articles in the upcoming magazine is about migraines, which again affect women differently than men. We've had articles about gut inflammation, articles about hormone replacement therapy. So it's important and great information for women just generally.
That's great. I really look forward to that migraine article. I somehow just developed that in my recent years, and so I'm interested to see, you know, how does that impact women differently. So I think that what's another thing that's so great is that these publications really speak to women throughout the life course, younger women and people who are maybe in retirement years. So I think that, again, your magazine is really great, and I hope that everyone that's listening goes out and to check out the website and make a request for magazines, or look at the past episodes or editions, pardon me, because it is really great content. So thank you, Wendy, for your question. If you're out there listening or have just joined us, we do take questions live on these live chats, so please feel free to type in your questions at any time in the chat box that you see at the bottom of your screen. It's Q&A. Click that and type in your questions. So we do have a few more questions that we got ahead of time via our Facebook page and our email list. So we did have a question from Cheryl, and she said, is Alzheimer's or dementia hereditary? So Lynn, would you mind speaking a little bit about that?
There are genes that make some people more susceptible, but part of the complexity of Alzheimer's is that you can have the gene and not get Alzheimer's, and you can not have the gene and still get Alzheimer's. And the reason for that is environment seems to play a part in terms of risk. And by environment, I mean outside factors that can affect someone's cognitive health. In the case of caregivers, the excess chronic levels of stress are one of those external factors that can impact someone's risk profile for Alzheimer's. So from a lifestyle point of view, keeping that stress in check is really important so that you don't succumb. And how you deal with stress, it can be different for different people. Some people may find going shopping
Mhm.
a stress reliever, maybe until they get the bill. But you know, it may be massage, it may be going to the gym or going for a run. Yoga and mindfulness are two very helpful ways of managing stress. And I do want to emphasize that because some research today is indicating that those things actually impact structurally your brain for the better. So again, keeping stress in check. And again, caregivers, I appreciate you're probably the last person that you think about, but I'll give you an analogy about why it's so important to think of yourself first. And when you're in an airplane and they talk about the oxygen masks coming down, they always say, you know, put your mask on yourself first and then your loved one. And I use that as an analogy because the same holds true in terms of providing care for anybody. You really have to look after yourself, and you know, to make sure that you're healthy enough to look after others. And you know, some ways that you might think about doing that is literally scheduling it into your day and blocking out. It can be a half an hour, you know, twice a day, just to take care of your own, you know, stress levels and make sure that you keep that in check, because it is one of those external factors that can impact your risk. Another one, believe it or not, is hearing. Hearing isolates you and can cause depression, both of which are precursors to dementia and Alzheimer's particularly. So, you know, what can you do to, you know, make sure that you have, you know, the right hearing aids, make sure that you continue to be part of a conversation with other people. So those type of factors can increase your risk profile. So genes are not just the only way that you can succumb. Yes, you're more likely if you do have a genetic risk, and that's why, again, lifestyle is so important in terms of protecting yourself. One of the scary things for women that some of the science is showing is that if you have a double oophorectomy, so both your ovaries out, and a hysterectomy before natural menopause, it can increase your risk of dementia by over 200%. So that's huge. And that's because there is a connection hormonally, obviously, in terms of your cognitive health. So you may need, you know, you might have ovarian cancer or other reasons why you might need to have your ovaries taken out or a hysterectomy. You just have to understand that there's increased risk, and what are those modifiable lifestyle choices that you can control to try and counter, you know, the risk that you might now find yourself in. So some of those modifiable lifestyle choices, I'd like to think of it ironically, in terms of MENS, M-E-N-S. So mental stimulation, M, you have to exercise your brain like it's a muscle. E, exercise increases the blood flow and oxygen flow to the brain. And if you hate to exercise, think of it this way: no pain, no brain. So exercise. Nutrition, we now know that things like salt and sugar cross the blood-brain barrier, and fat. Certain fats are good, other fats are not good. You have to eat well. One of the best diets in terms of protecting your cognitive health is something called the MIND diet, which is a combination of the Mediterranean style diet. A lot of people have heard of that. Fish, olive oil, nuts, lots of fruits and vegetables, combined with the DASH diet, which is low sodium to control hypertension. The MIND diet is easier to follow than the Mediterranean style diet, and even moderate adherence to it has shown to be very beneficial for cognitive health. So MENS, and there's 3 S's. So stress, keeping your stress in check, I already talked about, but again, social engagement, and we're not talking about how many social followers you have on Twitter or Facebook or Instagram. We're talking about, you know, those personal interactions with people. And very often when people start to forget things, they withdraw from social situations, which is exactly the opposite thing of what should happen. Again, you know, social engagement, very important for cognitive health. Women who have close social ties with family and friends have a 25% reduction in risk. So social engagement is very important, and sleep. Again, most women don't sleep well when you're, having kids. They keep you up at night. When you have teenagers, they like to talk to you in the middle of the night. When you go through menopause, most women can't sleep then either. But sleep is very important for getting rid of toxins in the brain and also consolidating memories. So those 6 lifestyle choices, which you can control, very important to protect your cognitive health. So MENSSS.
I like that analogy. Or that acronym. It's easy to remember, and so many great tips. And a lot of those kind of seem like general health tips. It can be, just keeping a healthy lifestyle can really go a long way in terms of your brain health. We did have, I know you touched on healthy eating and exercise a little bit, but somebody did write in and ask, what about healthy eating and exercise, and what role can that play? Do you have anything additional you want to add specifically on those 2 parts of the MENS acronym?
Yeah, as I said, diet is very important at any age. And again, if you think just generally, keeping a healthy heart also keeps your brain healthy. There is a connection between the 2. Other things in terms of diet, there are a few indulgences that we now know are good for your brain, which people might not know about. Dark chocolate, for instance, very good for your brain health. The higher the cocoa content, the better. And we're not talking about eating 3 chocolate bars a day, but in moderation, dark chocolate is very good for your brain. Coffee, believe it or not. For women, the recommendation, 3 cups a day, and we're talking about the caffeinated type. And also red wine contains resveratrol, which is also anti-inflammatory and good for your brain. Again, glass a day, not the bottle. So there are a few good things about keeping your brain healthy through proper eating. And also exercise, as you said, pumping up your brain, very important for keeping your memory intact. And again, the earlier you start in life, the stronger the protective effect will be. I heard about a study that was done, I believe it was in Texas, that talked about the decade where exercise had the best impact on cognitive health when you're in your 70s. And it happens to be exercise in your 20s. And again, the comment about the earlier you start, the better. Exercise in your 20s has the biggest impact in terms of your cognitive health in your 70s. Now, if you're in your 40s or your 50s, it doesn't mean that it's too late. But again, the earlier you start, the better.
Well, that's all good news about the dark chocolate, the coffee, and the red wine. I think we're all excited to probably hear about that as something that can, in moderation, be good for your brain. And that exercise, Lynn, do they find that like strength training versus aerobic exercises, is one better than the other, or is it mainly just being active in general that's good for your brain health?
Definitely aerobic. You got to get your heart pumping. I don't think it needs to be extreme aerobics. It can be a nice brisk walk too. But taking the stairs, you don't have to necessarily go to the gym. It can be walking, can be taking the stairs as opposed to the elevator. It can be gardening. But yes, it's a variety of exercises is best. Stretching, weight training, aerobic, all of these things are beneficial. Balance, very important. There's one way that it's a fairly simple way of seeing if you might have some cognitive risk, and that's balancing on one leg, where you're standing up straight and then you lift one knee, and whether or not you can hold it for 20 seconds, say 3 times in a row. Sometimes if you have a balance issue, assuming you don't have something wrong with your legs generally, but if your legs are in good health and you can balance, and if you cannot balance, it can be indicative of something happening. So you should definitely go to a doctor and check that out. So balance exercises is good to practice as well. So all kinds of exercise. And remember, ladies, hectic is not aerobic. You may have a very hectic lifestyle, but that doesn't mean you're getting proper aerobic exercise in.
Thank you for those tips. I think sometimes for me, it was just finding, a good type of exercise that I actually like and will look forward to engaging in. And that's really helped me stay committed to exercising. So it's good to know that, a variety of types of exercise can be beneficial. So hopefully people don't feel like, oh, they just have to go for a run, because that might not be for everyone. So,
right. It could be gardening, that's a lot of bending and up and down, and, it's do what you like to do. That'll help you do it more.
Yes, absolutely. Okay, so we have another question that we've gotten from Melissa. And if you have questions out there, you're listening, please feel free to type in your questions at any time in the chat, in the question and answer box on your screen there. But Melissa wrote, I've heard learning new skills, like learning a new language, can help, but I don't have time for that right now. What other activities can I easily do to help keep my brain healthy?
Right. So this was the first point that I had mentioned, mental stimulation. Mm-hmm. It can be as simple as, if you're right-handed, brushing your teeth with your left hand. It can be driving a different way to work every day. If you normally drive, if you go to park and you pull in, reverse in. It's all about new learning. That's important. So if you're a chess player, playing more chess isn't what we're talking about. It's about developing new neural pathways. You may have heard of neurogenesis. This is the thought about, how can you develop new connections in your brain, so as some parts start to fall off, other parts take over. Now, you had mentioned learning a new language. Yes, that's one of the best ways to actively engage your mind. Learning an instrument, also exceptional. You can learn how to tango dance if you want. These are really good ways of stretching your brain so that, again, it builds cognitive reserve.
I think that's, I think you gave so many good examples, and Melissa was saying, I don't really have time to learn a new language, and that, can seem very overwhelming. But, what's interesting, so my grandfather had just turned 80 last year, and he decided he wanted to learn a new language, and I had actually found an app on the smartphone. It was called Duolingo, and it just every day had like a 5-minute lesson on, he wanted to learn Spanish. So I think that technology is a great way to kind of help us integrate new opportunities for learning in, and even just my grandpa learning Spanish for 5 minutes a day, he can carry on, a very limited conversation, but it made it doable for him. So I think Melissa brought up a great point. You don't, as caregivers, as busy women, we don't have a lot of time, but there are opportunities throughout our daily routine and our hectic schedule where we can maybe take a couple minutes to do something new, or as you mentioned, just doing something with the opposite hand. Right. And we don't necessarily think about that as a way we're challenging our brain. But after, brushing your teeth the same way for 30 or 40 years, that right. would be a challenge for your brain to do it a different way. So
let me tell you something else about language. Yeah. They say that if you know more than one language, it can add 5 to 7 years cognitive reserve. So I can tell you about a study that was done actually at Baycrest with kids. And they had a group of kids in a room, and they were looking at a screen, and there was a clown that was on the screen. And then the clown disappeared from the screen, and all the kids that were monolistic, only knew one language, continued to look at that screen. But the kids that knew more than one language started looking around the room because their brains are wired differently because of different languages. And sure enough, there was a screen on the other side of the room, and up came the clown. And it just showed from a very early age how languages develop different neural pathways. So again, kudos to your grandfather for learning another language, even if it's 5 minutes a day, because it does, from a very early age, show that it does help develop new neural pathways. And you're never too old to learn new tricks. Got to tell you that. It's a myth to say that you can't.
That is such an interesting study. So thank you, Lynn, for all of those tips. And Teresa had actually wrote in, and she said one of her biggest challenges is not having enough time to herself. So I think for Melissa, Teresa, all the caregivers that are listening, you're not alone in that challenge and that struggle. I think as women, we tend to take on a lot of responsibilities and have very busy lives. And it is challenging to find time for yourself, for self-care. But Lynn, you mentioned earlier how important that is. Do you have any other thoughts on making time for yourself or the importance of that?
Again, I'll talk about the mindfulness piece again, because even when you go to sleep or try to go to sleep, very important to, calm your mind down. And we know that it does benefit your brain not only cognitively, but also structurally. So even if it's just during your regular downtime, if you have it, very important to do what you can to self-manage that stress with as little time as you can. Another way that people or another method that people find beneficial is to write. Go back to that diary days where you have the opportunity of getting some of that stress and anxiety out on paper. Also proven to be a very effective way for managing stress, and just sticking that some paper in your purse and carrying it with you, and whenever you have a spare moment, starting to write down some of your feelings can also be very beneficial to keep that stress in check.
That's a great tip. Journaling, that can be so therapeutic.
Yeah.
And also, when we talk to caregivers, we often talk about journaling, for their emotional well-being and to help with their caregiving journey as well. So whether it's journaling some of their loved ones' preferences or what is working versus what isn't working, journaling can be beneficial in so many different aspects of caregiving, and so that's a great tip that you offered here for us, Lynn. And if you have questions, please feel free to send those in to us via the Q&A box. But Lynn, I thought we've been talking a lot about reducing the risk, but we know that one of the important in terms of World Alzheimer's Day and World Alzheimer's Month, a big focus is early diagnosis and detection. So can you talk a little bit about that and the importance of it? I know even Dr. Pauline Mackey at one of your last events talked about the differences that maybe men and women have in the diagnosis process. And so could you just speak a little bit to that? Because I think that is important in this whole conversation on women's brain health as well.
Right. A lot of people are afraid of a diagnosis. They might fear losing their job or, having their driver's license taken away, even in the early stages of the disease. And many may feel, well, what's the difference because there's no cure anyway. And today for Alzheimer's specifically, there isn't a cure, but there are things that you can do to delay the progress as much as possible. And having an early diagnosis gives you the best opportunity to understand what you need to do to shore up your cognitive health. It does give you an opportunity to go into a clinical trial. Again, very important for finding an answer to diseases like Alzheimer's, is to have more people go into clinical trials, and also obviously set your house in order in terms of the type of care you may want, and looking after, financial arrangements, etc. So early detection is very important for people. Like I said, up until, if you remember, I talked about the eye exam. Up until recently, the only way to know for sure if you had Alzheimer's was through autopsy. Well, we're not going there, obviously. Some of the other methods are also pretty invasive. Not that invasive, but invasive, like spinal taps, fMRI. But they are experimenting today, many scientists are experimenting today with different types of blood tests for early detection. Like I mentioned earlier, through the eye, some signs of deterioration in smell also could be indicative of a problem. And by that I mean if you don't have an issue already in terms of your sense of smell, but if you can't recognize things like peanut butter or gasoline or a rose or a lemon, so strong senses, if you can't pick those up, that may be indicative of something else going on as well. Like I mentioned earlier, if you have a problem with balance, also grip strength. There are different things that people are looking for in terms of trying to figure out if there might be a problem. But people, I guess, have the best opportunity to help themselves and their loved ones if they go and get checked out by going to a specialist and seeing. There are other things also that you could have that mimic the memory loss of Alzheimer's disease. It may not be Alzheimer's, and these things are correctable. It could be a urinary tract infection. It could be untreated depression. It could be an underactive thyroid. All of these things can result in memory loss that mimic Alzheimer's disease. So again, another reason to go and get checked out, because those things can be corrected. Sleep apnea, women with sleep apnea, sort of where you catch your breath when you're sleeping and it can be stressful on your heart, are at increased risk for dementia. But again, a CPAP machine, they are available and it can correct the problem. So again, these are the types of things that need to be determined. And the earlier you find out, I think you're in the best position to do something for yourself or your loved one.
Thank you so much, Lynn. I think that people don't realize that it could be something else that are causing some of these similar symptoms that we see in Alzheimer's and dementia. So a lot of times when I talk with families, I give them that information, and sometimes it helps convince their loved one to finally go in and get evaluated because they know, wow, it might not even be dementia. And so there are some very treatable conditions that like you said, mimic. So thank you for that information. Libby has written in, and she says she's wondering about certain vitamins that women can take to help with brain health. She says that she takes a multivitamin, folic acid, vitamin E, omega-3, and B12, and she cooks with coconut oil because she had heard about some health benefits. So I know in your magazine you've touched on various vitamins and superfoods and whatnot. Can you give us a little insight on those types of things?
So the best way to get the proper nutrients in your body is obviously naturally through your food, but not everybody gets the same benefits from the foods that might be readily available to them. Another vitamin that's very important is D. D is really good for your brain health as well as your overall body, and actually has been recommended in terms of helping reduce your risk for cancer as well. So D is also very important, but vitamins C, B's, D's, K, as well as things like potassium and magnesium, all very good for your cognitive health. Again, if you can get them naturally through your food, that's always best, but if you can't, then yes, supplementing them I think is important.
That's great information. Thank you so much, Lynn, and thank you for Libby for writing in. We do have time for a couple more questions, so please feel free to type in your questions at any time. As we're going to take a few more questions. In the meantime, let's flip to our resource slide. I know that we've been talking about various resources that people can go to for information. So we do have the womensbrainhealth.org website there. You can find the Mind Over Matter magazine there. They also have some great articles. They have wonderful social media channels too. I like to follow their Instagram for just quick tips and reminders on how to keep your brain healthy. And then we have our Help for Alzheimer's Families website and our Facebook page as well, Remember for Alzheimer's. We also have Confidence to Care, and that's specific to caregiving, helps you understand some symptoms your loved one might be exhibiting and ways to deal with that. And Lynn's been talking about the stress that a caregiver might be going through and how that could impact her long-term health effects in terms of her brain health. So caregiverstress.com is a great site if you want to learn more about that. And if you need some time away from your caregiving situation or help in caring for your loved one, you can visit our website at homeinstead.com. And then the Alzheimer's Association's website, alz.org, is another great site where you can get information, get connected to support groups, and again, more information on Alzheimer's disease and the symptoms, and learn about how to better care for your loved one and be supported by those in your community. So again, check out those resources for more information. So, Lynn, can you talk about any of the mind over matter articles or subjects that have really created the most buzz over the last year or so? I know each month there's kind of a theme. Is there some that have resonated more so than others that you've seen, or ones that you've had high response rates to?
Yeah, one of the articles that we wrote in the very first edition was actually a reprint from a Dr. Neal, who talked about the 10 drugs that may cause memory loss. We've reproduced it a few times on our website, on our blog, and it gets the most hits every day because a lot of people fear that the medication that they're taking could in fact be impacting their memory. And yes, that is actually true. Now, I wouldn't recommend, especially if you're under a doctor's care, to go off a particular medication, but knowing that it may be adversely impacting on your cognition could be something that you should understand and have that conversation with your doctor, because there may be an alternative medication to control whatever you need it for, and keep that in check without impacting on your memory. So that one definitely has had the most play just generally. But there's also been a lot about gut inflammation, and there seems to be this gut-brain axis connection, that what you eat and how you digest food can impact on your brain. And that seems to have gotten a lot of interest. We also do a lot of recipes. You talked about superfoods, and I have talked about the Mind Diet, but we also have a sister website called memorymorsels.org, and there's all kinds of great brain healthy recipes on that, and as well as other brain healthy tips. So in each edition of Mind Over Matter magazine, we also put in some recipes, very often from celebrity chefs, that are good for your cognitive health. And also the relationship between, again, heart and brain. Women's heart health and stroke, risk for stroke often has shown similar issues as we've uncovered in brain health, meaning that the symptoms present differently. A lot of women were having heart attacks because they went into the hospital with different symptoms, and it wasn't recognized as being a heart attack. Same with stroke. So we have written about all of these connections between heart and brain, and also the differences in the research focused on very much on men in these areas, and then symptoms and risk profiles are different for women. So those seem to have gotten a lot of interest as well. Again, we always try and have some articles around caregiving issue, and then again, what's happening on the research side, particularly for women, also has attracted a lot of attention. And now, because of the type of advocacy work that we're doing in Canada anyways, scientists, in order to get funded by the Canadian government, must defend why they're not considering sex and gender in their studies, and the difference being sex meaning the chromosomes, male, women and men, versus social influences, which is where gender comes into play. So they have to look at both now before they can get funded, which is huge, because that didn't happen 5 years ago.
Yeah, I'm glad you touched on your advocacy work in the research area, because I did think that was incredible that now your organization, because of its advocacy, scientists are having to consider that. And at the Alzheimer's Disease International Conference that you and I both attended, you sat on a panel, did a wonderful job, but there was a lot of conversation about how across the globe that should become, the norm for scientists, researchers to consider the differences of sex and gender in their research studies, so that women and men can receive even better treatment, diagnosis, and all of the sort, because we are different
Right.
in so many ways. And then Women's Brain Health Initiative, can you speak a little bit about the, you have recently funded one of the first female research chairs in sex and gender. Can you just talk a little bit about that as well?
Yeah, so a research chair is it's a descriptive term for a position where there's more focus on an area of study, in this case, women's brain health and aging. It's a new area of study, so it's not quite a department, say in a university. So it's a chair position. It's very well respected, and we gave Canadian researchers an opportunity to apply for a research grant for this chair position with the help of the Ontario Brain Institute and the Canadian Institutes of Health Research, which is like your NIH. And we co-funded the world's first research chair in women's brain health and aging, which was awarded to Dr. Gillian Einstein at the University of Toronto. And who wouldn't want an Einstein looking after their brain health? She does say she's a descendant of Albert, so that's good. But she is now taking more time and more energy to study the impact on hormone and hormone depletion. And I talked to you earlier about if you have a hysterectomy or a double oophorectomy, what is the impact on losing, estrogen for women who lose estrogen, which they do naturally through menopause. What happens to their brain if it is depleted prematurely and even through natural menopause? Because we do know that estrogen is neuroprotective. Men continue to produce estrogen because testosterone converts to estrogen in the brain, so they still have the protection that women don't when they go through menopause. So she's looking at particular hormones in terms of what the impact is for women and cognitive health. But the reason, again, that the education piece is important is because until the science catches up, what can you do to protect yourself? And again, the earlier that you think about protecting yourself, the better. And this is for caregivers as well as not for caregivers, just for women just generally.
That is such a great point. We at Home Instead talk about, until there's a cure, there's care. And so, caregivers need support and resources as they care for those that are currently living with the disease, while the science catches up to the cure or the treatment or the prevention side of things. But I like that we've focused, this entire hour on ways that we can reduce the risk of developing the disease, because I think that is equally as important, especially as future generations age, and we're living so much longer now. So we don't often think about, what we're doing in our 20s and 30s having a lasting impact. So if we can start that conversation and narrative at a younger age, it'll be interesting to see the impact that has years down the road as the younger generations age, and as the science and research catches up. So thank you for sharing for that information, and thank you for, as an organization, for advocating for women's brain health and for providing communities across the globe with such a wealth of information. I think that's admirable. So we're so excited to be part of Women's Brain Health Initiative. You guys do such great work.
Well, it's great to have partners like Home Instead, just to give a little love back, because it helps us understand different perspectives when we do things like our Mind Over Matter magazine. So your organization has been very helpful in talking about the caregiver side and what some of the issues are. And then we can delve further into that and communicate it, I guess, in a different way than you can through our blog and through our Instagram posts, for instance. You talked about that. So that's at Women's Brains, through our Mind Over Matter magazine and publications. So thank you for being part of the conversation that we share with everybody.
Oh, well, it's such a pleasure. We complement each other so well, our organization. So, well, I'm going to advance the slide just here quickly to tell you all about our next live chat that we have coming up. Meryl Colmer is going to be joining us about her caregiving experience, her personal journey. Her husband and her mother are living with Alzheimer's disease, and so she's an award-winning journalist, has a beautiful book about her experience, and will share with us. She said she wants to get a little kind of raw and dive into some of the issues that people don't necessarily talk about in terms of caregiving. So I'm really looking forward to that. And Meryl also has been a part of Women's Brain Health Initiative's journey too. So we're all working together, and Meryl has taken her personal journey and has made it her life's work in this part of her life, advocating for Alzheimer's disease and for family caregivers. So if you're around on October 16th, we ask that you join us. This registration isn't live quite yet. We're still working on a few final details, but you will be able to register at helpforalzheimersfamilies.com. And if you have any questions for Meryl, you can chat them to our email livechat@homeinstead.com. Or if you have more questions about today's live chat about women's brain health that you didn't get to ask since we're almost out of time, or if you didn't want to ask it live, please send us an email and we'll get your questions answered there. We also have an weekly email list that you can join on our helpforalzheimersfamilies.com website. Each week we send that email out, has tips, resources. We often ask a question from a family caregiver and then ask for you to respond and share with us how you've tackled that question or challenge. So a great community to be a part of in terms of caregiving. So we look forward to seeing you on October 16th. But before I say goodbye to everyone, Lynn, I just want to thank you so much for joining us today, for sharing about women's brain health, how we can preserve our brain health, whether we're a family caregiver or a young woman in our 20s and 30s. I think this is such an important conversation. So thank you for your time and your expertise and your resources.
Thank you for having me. It was a pleasure.
All right, everyone. Well, have a great rest of your day. We look forward to seeing you next month, October 16th. And until then, be kind to yourself and take care. Bye.
Bye-bye.